Okay, unhappy triad. When do we get unhappy triad? Unhappy triad refers to the fact that when there's damage to the lateral location of the knee, we get simultaneous damage to the anterior cruciate ligament, the medial meniscus, and the medial collateral ligament, all at the same time. And this most happens with contact sports. So let's say that you're playing football and you catch a pass. Okay, so this is you. You basically catch a pass. So it's going to be bad drawing, but hopefully it gets the point across. So you catch a pass and you have your legs planted to the ground. Okay, and there's someone coming in and tackling you. And when they tackle you, there's basically force coming to the lateral side of your knee. Okay, there's a lot of force that comes to the lateral side of the knee. And when this happens, it could create this unhappy triad where we get damage, where we get simultaneous damage to the anterior cruciate ligament, the medial meniscus, as well as the medial collateral ligament, which is here. On USMLE, questions testing this concept will look like this. An 18-year-old man comes in after sustaining a knee injury during football practice. Okay? He says he landed with a planted knee and was kicked by another player on the lateral side of the knee. On examination of the injured knee, the tibia is displaced anteriorly from the femur in the flex position. Okay, what does this tell us? On examination of the injured knee, the tibia is displaced anteriorly from the femur in the flex position. This tells us that there's something wrong with the ACL, because if ACL was intact, then we would not have the tibia being displaced anterior to the femur. Okay, the ACL's function is to prevent that. So when we read this line, we immediately think that there's something wrong with the ACL. The question stem also tells us that there's laxity of the knee with valgus stress at 0 degrees of flexion. Valgus stress tests for the function of the medial collateral ligament. Okay, and think of the test like this. So this is the person, and this is their leg. Okay, and when doing the valgus test, you basically place your hand above the ankle joint and you place your other hand on the femur to stabilize the femur. And so what you do is you basically externally rotate the knee and at the same time abduct the tibia. So you externally rotate the tibia as well as abduct at the same time. And when you do this maneuver, you put pressure to the medial collateral ligament. So, and when you do this maneuver, if the patient feels pain, then this tells you that there's something wrong with the MCL. So, because there's laxity, meaning it's loose, we're assuming that the MCL must also be damaged. The question then goes on to say that there's a click heard when the patient's knee is externally rotated and passively extended from 90 degrees to 0 degrees. This is the McMurray's test, and McMurray's test is a maneuver that tells us if the medial meniscus is damaged or not. And if we hear a click sound while doing this maneuver, then this tells us that there might be damage to the medial meniscus. And so because we hear the click, then we're assuming that there's something wrong with the medial meniscus. So looking up the options, we're going to go with C.